Hi, I'm Dr. Gorman. I wanted to talk today a little bit about sinus issues, especially in the fall and going into the winter. That tends to be when the sinuses are at their worst. Now, some people have chronic sinus issues, and everything I'm going to talk about will certainly fit for that, because one of our fortes is trying to identify the root cause, especially of difficult and challenging health conditions that people aren't figuring out. So, when it comes to sinus stuff, first and foremost, as a chiropractor, the most common thing I see contributing to sinus infections and sinus imbalances is the upper neck being out of alignment. So if we just take a look at some very simple, keep it simple, basic anatomy. This is the first nerve coming off the spine. This is the second. Okay, C2, or that second nerve, actually sends the signal from your brain up here, comes out here, and it goes to your sinus. It actually controls and regulates your sinuses. If this nerve is what we call subluxated, or a fancy word for pinched or choked or interfered with, if this is rotated just a little bit, that can block that signal as much as 60% in research. So you may only have 30-40% of the signal getting to your sinuses. If you have that for a while, of course things are going to start to not work right and malfunction. And as a result, you're going to get congestion, you're going to get sinus issues. How do I know that to be true clinically, aside from the research and the anatomy? I can't tell you. In the winter, at least once a day, if not 2, 3, 4 times, someone comes in with congested sinuses. I check, C2 is out of alignment. I perform a gentle adjustment, and as soon as I do, they get off the table and say, "Doc, that's amazing. My sinus is just drained." I literally am disappointed if I don't hear that, because it's that common. So nowadays, with everybody sitting so much and so much stress, people carrying so much stress in their neck, right? Their neck muscles get tighter, it causes more tension, and that causes that to happen more and more. Now, what else causes especially chronic sinus stuff? Well, let me just explain something. The whole digestive system is one tube, right? It comes from your anus coming all the way up through your large intestine, small intestine, stomach, through your esophagus, up into your mouth. But that same thing, splits up, goes up into your nose, and it branches off into your sinuses. So many chronic sinus infections, the root cause is actually coming from your digestive system and your gut. So it comes from an imbalance of yeast. You could have parasites. You could have just not enough good bacteria. You've probably heard of the word probiotics, but it's very complicated. A lot of not having enough good bacteria, too many foods with antibiotics, too many other issues with toxicity, start to stress, it all wreaks havoc on our digestive system, and you've got to have a way of addressing that. And so as that creates an imbalance here, the yeast or the imbalance slowly works its way up, and we end up with yeast in our sinuses, yeast in our ears, causing ear infections or contributing to them, and so on and so forth. So all this stuff is playing a part when it comes to chronic sinus stuff. So what else do we look at? We look everything we do. We look at the brain controlling the sinuses. We look at physical stress. In this case, it's primarily the neck, but we could have dental issues that could contribute to chronic sinus stuff. We could have whiplash or previous injuries that affect either the neck or some of the bones in our cranium, and they get out of balance, and that contributes to sinus stuff. We could have food allergies or food sensitivities that going on that are contributing to chronic inflammation and chronic sinus issues. So these are all the things that we evaluate in our office, and we look at, and we have solutions and treatments for, both some treatments in the office and education and recommendations for lifestyle changes for you. For example, a real common cause of, speaking of food sensitivities, is gluten or dairy sensitivities. I can't tell you how many people have gotten off that, and their sinuses have gotten better. So there is a variety of things related to physical things, chemical, nutritional, toxicity things, and emotional and mental stress factors that we look at for sinuses. For more information on that or more of the other things that we address, please feel free to visit our website, gorman-health.com, and check us out on YouTube and social media. Thank you.